So I think the first thing is, first of all, to recognise that actually it's time that is the connecting currency in healthcare. It's not money and facilities, it's time. And if you think about from patients' time, access targets are measured in time, like ED waits, waiting lists are measured in time. Time is a consequence, or harm is a consequence of time ill spent. There's some wonderful work done by Chris Moulton et al., which for patients who have spent more than 6 to 8 hours in ED, there will be an additional death for every 82 patients who are admitted. So time is harmful. If you spend too long in hospital, and this is where NPJ paralysis and deconditioning comes to the party, we know that, in fact, I've just done a quick fast facts on it this afternoon, filming with Will Dolan and Firewood Pictures and the team, is that we know that deconditioning is a harm event, and the longer you stay in bed, the more harm that prevails. So harm is a consequence of time ill spent. But it's not just about patients, it's also about staff as well. The time we waste, you're hunting for things, like you're running around the ward looking for an obs machine, and then you find two of them huddled together like a survivor off the Titanic. Going to pointless meetings, which I'm sure nobody here has ever had to deal with. 70% of the NHS budget, in fact, all budgets all over the place. And I see my friend Diane Gurney, who's just come in from the United States, so welcome. But it'll be the same in the States, the same any health system in the world, because the only thing that changes in healthcare, frankly, is the accent, something I don't have. But in most countries, 70% of the budget is spent on staff salaries and wages. And they are representative of the purchase of our most important currency, which is our time. So in fact, it is time that connects it. So when we're looking to manage people's time, value people's time, that means rethinking what we think about time, because 21st century literacy will not be about whether we can read or write, it's whether we can learn, unlearn, and relearn. And if we meaningfully valued patients' time as the most important currency, because while our time is busy, our patients' time is sacred. And that would mean that people would not spend needless time waiting in the back of an ambulance, waiting to get into an emergency department, waiting to get out of an emergency department to get into a hospital bed, waiting to get out of a hospital, because we're still decades on, still doing TTOs where the ward rounds happen and for prevent reasons.
Day for tablets.
They do, and to my mind, we don't let them go home because we haven't done our bit. So is that just not hostage taking? Are we not holding them hostage until we do get our act together in healthcare systems? And there's some wonderful work being led by Hilary Garrett and others from Team CNO. And what that's about is how do we recalibrate our thinking around discharge and rethink what we do and know about discharge as well. So those are all of the elements. And I think the first starts with, it's almost this question, which is crucial to the last 1,000 days, which is, if you had 1,000 days left to live, how many would you choose to spend in hospital? And if we really focus our energy around time, we would find ways of short-circuiting all of the waste of people's time. That's quite
a profound way of looking at it, isn't it, Brian, rather than targets and money, which are important, granted, but measuring elements of care in time, that's really profound.
Well, thank you. And I'd like to hope so. And doing some work now with Somerset Health System. Lucy Knight, Dr. Lucy Knight is a geriatrician down that way, and the wider team, around how can we start to look at valuing patients' time from a system level. And you're absolutely right, Vanda. This is about rethinking how we can, it's not about the measures per se, because you can hit the target and miss the point. It's, do we need to rethink the measures that we've got? And here's the saddest bit of all. I was one of the people, like many, big supporter of the NHS reforms of 2000, which brought in targets. Unfortunately, it was the narrative that was problematic.
Absolutely.
Because if they'd started talking about targets, if they talked about these are standards a civil society should value, because this is about valuing staff time, it's about valuing patient time, it's about improving patient safety, improving their experience. And also, when something works for patients, it always works for staff. if that was the narrative, then maybe there wouldn't have been the level of pushback and the transactionalism where the target became the goal, not the improved experience.
Absolutely, and I'm sure many people agree with you, Brian.